Yeah, so it looks like we've got the delegates we're expecting on the call, so thanks for joining us today. My name is Matthew Mahoney. I'm the Director of Digital Transformation for Block Solutions Limited. We're here today really for the first in a series of webinars about healthcare and networking, and today we're talking about real-time location tracking in healthcare. There's a Q&A session in the chat, so please feel free to kind of join in and ask some good questions in the chat, and we'll try and pick those up as we go through the webinar. So I said who I am. Steve?
Yeah, good morning. I'm Stephen Hawley. I'm an IoT disruptive consulting practice with disruptive emerging technologies at Ingram Micro, working in partnership with Matt and the Block team to see what we can bring that's properly life-changing, we'd like to say, in terms of tech that actually delivers something in the real world of healthcare.
Fantastic. Thanks, Steve. There we go. So we'll have a bit of a chat about location tracking, think about some use cases of that, talk about Contact.io, and we'll have a demonstration of the solution. And as I said, there'll be a Q&A. It'd be great to get questions as we go through, but hopefully we'll get those fed through to us via the chat. So next slide, please, Steve. Lovely. So over to you. So
well, look, so it's supposedly a breakfast meeting, but I'm assuming everyone's had their breakfast already. But yeah, so first things first, really wanted to take a look at what this space is all around. It's all around location and where things are, but that space has been around. The space itself has been around for some time, and understanding where something is not necessarily as easy as it might first appear. Is it a viable technology for the NHS to spend on, for example? So we're going to look at what different technologies are out there, and what we're actually going to focus on today is one that we think is really exciting for healthcare, and especially acute hospitals to be looking at today, which you can see here in the image. Is a tiny little tag here, but it's using Bluetooth technology, but it also uses the benefit of infrared technology, which we're going to cover off a little bit later, which gives us extra information. So first things first, Matt, what's your experience and what's your knowledge around location tracking?
So I'm a little bit old, as you can probably tell. So I guess for me, like RFID tracking is probably something I would be familiar with. The little tags that you'd have, like on, classic example for me, going to HMV and seeing those stickers on the CDs. You've got the big gates on the exit of the store, and you kind of know where something is because it's either in the store or it's gone past that barrier. So in healthcare, in the health board that I worked in, they had some use cases of that. They would tag laundry, for example, so they'd know where laundry had been, and they might know that it had been to a particular site in the health board, or that it had gone off to a different location in the health board, but they wouldn't necessarily know where it was at any particular time in its life cycle. So it was sort of useful. It was quite a good business case for them. It actually helped them save quite a lot of money, but it wasn't giving them that real-time tracking. Another example I could think of more recently in the health board was that they were using it to really just kind of like audit the capital assets, if you will, from a financial perspective, so from a governance perspective. And it was very, very manual. They would literally go through with like a trolley and scan, kind of the area that they were in, and they would find where things were on that day at that moment in time. So again, useful from an auditing perspective, but let's just say, you're a clinician, you desperately need the infusion pump or something. Really, you're kind of just asking people on the ward probably where that piece of equipment is.
So things like being able to understand how it's being used, how often it's being used, where we've got them right now, and are they even on the right floor or in the right department, for example, that wouldn't really be possible.
Not really. I think some of the equipment's got that kind of capability built in, but obviously you've got to go to the piece of equipment. You've got to know where it is to be able to derive that information, and just being able to pick up things where they are when you need them most. That just wasn't really something that was that simple. If you lost something, there could quite often be some kind of interesting challenges in terms of finding it.
So from an IT team perspective as well, how did that feature in terms of what you were doing, and was it a big part of an everyday role to be able to support that sort of technology? Not
really. So I mean, a lot of systems in healthcare sort of evolved. So like the informatics department, the ICT departments that provides the infrastructure and the services and support and enable some of these applications. But quite often divisions and areas are able to go off and purchase and procure systems themselves. So what we would what we'd see is our involvement would be quite lightweight. Often it would be that we'd need to perhaps provision a server or maybe help them with some devices that they were using to track equipment, or every now and then I've got a few recollections of people saying, is there any way we could like maybe use the Wi-Fi to try and track something down? But that would be really, really challenging because, of course, the equipment might be turned off. It might not have an active IP lease. Don't want to get too technical. There are ways of finding things with the Wi-Fi, but if it's not on, or if it's not connected, or hasn't been connected for a while, you kind of, you're really sort of struggling with that one, I think.
Interesting, because you mentioned about Wi-Fi there, and just from my own knowledge of Wi-Fi, how broad it's radio waves at the end of the day. So radio passes through walls. So the best you're ever going to get is a range or an approximation or a radius if you've got the right density of wireless access points that's broadcasting. So there's all sorts of limitations here, aren't there, in a real operating environment. These are some of the things that we're going to cover off today.
So yeah, I mean, interestingly, you sort of mentioned some of the challenges. What do you think are the sort of use cases and the benefits of location tracking?
Well, if we think about clinical equipment, which you've already mentioned there, that's where we think is a really good place to start, because there are trials of various different technologies that go on out there, but they generally can't scale because they're too costly and they're too difficult to implement. So, and when I talk about implementing, if you have or haven't got the perfect Wi-Fi network, then what? Well, then we're into what we call IoT gateways. So we put sensors on things and they're going to have to talk to some other device, which is going to have to be cable run. So there's PoE or data cabling, there might be power cabling, all of the reasons why you wouldn't want to close down a ward, work out how to get cable runs through, old asbestos filled buildings, etc. So there's lots of complication, but really what we want to get down to is I need to know where my IV pumps are, the syringe drivers. I need to know where the wheelchairs, the beds, the rental equipment that I'm paying monthly for. I can't afford to lose that at any time. So lots of use cases around the assets, and one really important one is around preventive maintenance and audit and compliance, to say this has been certified, calibrated, tested, compliant to be back in use. So that's a really, really key one that we think we can confidently address today.
So in terms of is a method of tracking equipment, what is happening in the location tracking space at the moment? What's the latest technology available?
Yeah, so good question, because everyone I speak to in trust always uses the 4 letters RFID. RFID is everything, but that's just one type of technology. So really we need to replace that with RTLS, which is the real-time location services and solutions that fit in there. And the real-time piece of this, if we do it right, allows us to automate a whole host of other things behind the scenes. So that's what we're going to show today, further down the line with the demo. But the difference here and the way that technology has moved on is now using low energy, so battery power for everything. So if we need to use a tag, and you've got one right there, which might be a good one to show up as an example of a small, lightweight ways. I don't know if you can even see it on this camera, but yeah, I mean, it's super tiny. And this is the Contact Nano tag, which could be worn on a patient wristband. It could be on a bed or an oxygen rental bed or an oxygen cylinder, something like that. And this is using Bluetooth, low energy. So the battery life in these sort of tags anywhere up to 6, 7, even longer years, because the larger tags for perhaps an IV pump has an accelerometer in it. So it's taking advantage of that technology to turn itself on and off, so it's not constantly having to transmit. Now on the Wi-Fi tags, battery life is really poor. It takes a huge amount of energy. You're also then having to think about the Wi-Fi network itself to support Wi-Fi based tags. RFID, if they're passive, you're going to have to put gateways in. If they're active, again, it's using Wi-Fi technology to get in there. And Wi-Fi has its limitations. It's not really the perfect means for IoT. BLE is great because of the long battery life, but also when we bring in infrared into that, then we have another box of the contact portal beam, which allows us to map a room with infrared, and infrared doesn't go through walls. So now all of a sudden, we're into the world of we can be 100% confident that a particular asset, person, or staff member is in a specific space. No longer is it 5 meter, 10, 20, 30 meter accuracy. We can say they're definitely in this room where we are today.
Yeah, so you have a mixture of room based location tracking devices and maybe more specific wards, or I don't know, let's think of a warehouse perhaps where there's equipment being stored.
Yeah.
You just need to know it's in that warehouse.
Exactly.
You've got a level of accuracy. You don't need to specifically know that it's in a particular room at a particular point in time. That's really interesting. So on the screen, we're sort of talking about location tracking of patients and clinical equipment as well. So we can see this. It's almost like a chewing gum, isn't it? I feel like eating it in a way.
That's the breakfast meeting.
Well, yeah, it is incredibly light. I think, you know, you quite easily pop that on your wristband. You wouldn't even know it was there. So you've talked about safeguarding on the screen. What do we mean in terms of what are the opportunities around safeguarding, particularly around patients?
Yeah, so, I guess if we take you know, patients at risk, it could be frail, elderly, dementia patients. We need to know that they're not where they shouldn't be, and they are where they should be. Equally, someone who's just had a hip replacement or a leg cast put on, and they're wandering off somewhere and they decide to disconnect themselves. So lots of reasons we might want to know where a patient is or how long they're spending there, and having automatically the system to tell us someone has left that area, or perhaps a patient at risk has entered the stairwell and is disappearing off. It's, you know, and the only way we could really be able to do this properly is to have a good level of accuracy, which we can do with Bluetooth, and density, and supported by, you know, Cisco infrastructure that's ideally optimized for this. And then we add on, as you said, the room level infrared piece where we need it, perhaps in certain areas. And now we know the second someone has left, but we might set a rule to say it's fine for them to walk out for 2 minutes, but if they're not back after 3, then we need to alert a nurse or a healthcare professional to go and find them.
It's really interesting. So you know, we've talked about some of the safeguarding issues in terms of patients. How can I put it like staff as well? Because same principle, really, isn't it?
It absolutely is. So for that, you know, the smart badge here is standard. Badges will just slide into them, and it's a Bluetooth device. It will work with the, you know, with the room level accuracy as well. And this is something that also has a couple of buttons on the back, and they're programmable. So we could program, for example, I'm about to lift a heavy patient. Can I get someone else to support me? It could be it's a safety situation that perhaps a patient's relative is slightly upset with the standard of care today for whatever reason. And I might need help from a porter or security, whatever that looks like. But I'm not actually in a room or by a bed where I can pull a cord. Perhaps I'm, you know, I'm a nurse and I'm out in the corridor where this is starting to happen. So it's important that I know my colleagues can find me very quickly, and it's not a 20-meter radius, and they have to go in and out 3 or 4 rooms looking for me. They need to know exactly where I am, so that I feel comfortable at that point.
You mentioned the, you know, the badge. That's something that I still feel like I wear it. So you know, my NHS badge in the chassis, so not the ID piece itself, but it's the actual sort of like chassis for the badge, is actually something that can be the Bluetooth enabled device with the alert buttons on it, and you know, there's no, I suppose there's no barrier to really wearing that. Everyone's familiar with that kind of concept of wearing the badge. You've got that with you at all times, unless you forget it or can't get it. But you know, it sounds quite useful. So you mentioned Cisco just now. I mean, how does this work with the kind of existing IT infrastructure? Because we talked about some of the challenges of RFID, the challenges of some of the sort of like, you know, the capital estate, if you will, in healthcare. There are some really great new facilities in, you know, certainly the health that I worked in. There are some older ones as well, which you know. I know a lot of network engineers and sort of like operational teams will understand those buildings, as you said, have got a lot of challenges. So do we need to install new infrastructure? Because that can often be a barrier, can't it?
Absolutely. So, the short answer is no, but ultimately it's well worth investing in that for the future, because the way that Cisco have approached this, which is very smart, is to think about how the wireless, the LAN, the local network and the wireless infrastructure can support IoT at scale. And to do that is more than just having a BLE radio. And this is all around, you know, the controllers for these APs and backhauling all of this data out to cloud and third parties and integrations. So all of that is there. The ultimate aim as a long-term picture is probably highly recommended to look at the Cisco Wi-Fi 6 Catalyst Cat9K series infrastructure. DNA Spaces is designed for all of this IoT data to pass straight through, Firehose API for the technical people on the call today, and pass that all through so it can go and be computed and have all these rule engines, etc. However, the realistic situation is people have invested in new infrastructure that still hasn't got there, and it might be a few more years to get there. But that's fine, because we also have a solution that helps with network migration. So an older Cisco network was another service that we can offer with the contact team that allows them to get up and running today. So all of the things that we'll show you over the course of this morning's session is all available to start today. You can pilot it today, anywhere, whatever the state of that network. But ultimately, that's an additional service that, you know, further down the line, you want to start scaling this across maybe one acute site, two, maybe up to the ICS level and broader. Then it's something that, you know, having the right network infrastructure allows you to say, I only have to ask IT once, and I'll never have to ask them again every time I want to add on more IV pumps, more rental beds, more patients, staff. Once you've got the infrastructure and the right foundation in place, all of this IoT will just seamlessly drop in over the top, and you can scale it.
And yeah, you know, I think Wi-Fi 6 has been around a while now, isn't it? So I would expect probably with my IT head on again that if you've not already got Wi-Fi 6, you'll probably come up to a refresh pretty soon to be able to move to an AP with Wi-Fi 6. And again, if you're using Cisco networking, quite likely that you might already be on Catalyst. If you're not using the DNA Spaces features, you know, that's a license upgrade rather than a physical change that you've got to undergo. So, you know, again, I think there's opportunities there just to think about kind of non-disruptive from a physical sort of change. So we've had a good chat about some of the use cases of, you know, real-time location tracking in healthcare. We've also talked about their devices, staff, and patients. Let's just focus a bit more on loss prevention. Just, you know, I think I know what you mean by that, but go on, Steve.
So loss prevention, even round to IT assets.
Yeah.
So you mentioned that earlier. You know, it's all very well having a device with Wi-Fi in it and connectivity when it's on, and then I'll get an approximate range. Now, it might be connected to not the closest wireless access point either. The nature of networking, there's no guarantee it's necessarily sitting right underneath an AP. So I could still have to go off and interrupt lots of people looking for that particular device. It might be battery died 3 months ago, no one had a charger, or there wasn't a cable available or a plug socket. I mean, I've heard all sorts of stories. So even a small tag attached to one of these that are constantly transmitting, you're never going to lose it, you know, for 6, 7, 8 years.
Would that be a tag like this? Or?
Probably a slightly larger one than that one. This is a disposable service, which is why it's so tiny. It's designed for, you know, up to 60 days for patients coming in and out, perhaps for rental equipment. But yeah, a slightly larger tag, and we're now moving to the world of stickers as well. So Bluetooth devices. Absolutely that.
Very simple and non-disruptive.
Credit card sort of size is where we're at now. So very flat, you know, these sort of things can easily drop onto your IT equipment. And at that point, we're away, because you know you don't have to worry about losing it, but you can also geofence it. So you could say if that's going out of that department, it's going off site, it's found its way into an ambulance, whatever it is, you know, all of that data is going to be captured there in the cloud.
Yeah. Interesting. I think, yeah, one of the challenges we had was that during the pandemic, a lot of equipment was bought and handed out. It wasn't necessarily used to the best of its capability, should we say, and sometimes things may be hoarded or hidden away. And of course, now we've got to a position where it's actually quite hard to get hold of some equipment because of the worldwide chip shortage. The organisation needs laptops, it needs IT equipment. It probably has it, but it doesn't necessarily know where it is. So I think it's, you know, quite useful to the use case there.
There's a common point I just pick up on that one, which is around trying to reduce wastage and trying to prevent buffer stocks of anything, whether it's a clinical device or an IT device, whatever it may be. If we know how many we've exactly got, where they are, and how best to distribute them across the campus, we shouldn't have to constantly be buying new and buying more.
It's all about value for money and getting the most out of what you got, isn't it?
Yeah, absolutely.
We've talked about staff safety and safeguarding. Let's talk about the difference between real-time location tracking then and now.
Yeah, so we've covered this right at the beginning, just very loosely, but some of the things that perhaps our guests on the call today have already seen, you know, this idea around how long it takes to get value, because we've decided as a particular team, perhaps the states are sponsoring this and saying, we'd love to know and we'll support where things are. Perhaps there was an IT project going on to say we need to know where our printers are or our mobile devices. But the cost of tags, the dedicated infrastructure, and more importantly, when you've got low battery life, which you have with every Wi-Fi tag. I mean, one of them, there's a fantastic one out there that I've seen, even featuring in tenders today, has two-way communication, but it has a maximum of a 24-hour battery life, and it's £100. So it's, you know, it's costly, great tech, but actually realistically, is it ever going to be able to scale in something the size of an NHS trust? Probably not. And 24-hour battery life, now we're having to think about chargers and process and all of these things that now human involvement is this, we've lost that automation. What we're trying to do here is if the tags are just off and running for 5, 6, 7, 8 years, now we can let the software teams do their bit, build up the automation. What happens if this leaves here? What happens if we haven't heard from it? What happens if there's 3 things in the room together? There's a caregiver, a patient, and a pump. Hold on a minute. That means we now know how we're utilizing key medical equipment and how much time the doctors are spending with the patients. All of this data is then being collected for us to look at operational running of the hospital.
Yes, making sure that you've just got a bit of an analysis of flow through the system, just efficiency in the system, making sure that you're getting the best out of the resources that you've got, and arguably making sure people are taking a break and those kind of things as well, because it's quite a high pressure environment, isn't it?
Yeah, and there's one other thing that's just worth pulling out here, which a number of times I've been asked around. This is great to have all this new tech, but what about all the existing systems we've already got? So electronic patient records, medical records. What about the portering application that we're already using? All of these sort of things that really, or even the asset register. So if the hospital's already got an asset register, are you saying I'm going to have to go and manually add all these things in? No, this is a platform that's open API in both directions, allows us to integrate with other systems. It allows us to pull data from systems and share that. And I'll show you what that looks like in the demo.
Okay, so yeah, do you want to tell me a bit about Contact.io and go through the types of devices? We talked about some of these things already, but what are we seeing on the screen here, Stephen? Yeah,
so what we've got here, and I'm hoping that you might see my mouse as well. So here's the asset tag 2. This is kind of the core piece really to most of the clinical medical equipment. So services for medical equipment is what we offer, and the services here include this little tag. This is the staff badge, or smart badge, which has these programmable buttons on the back as well, and the nano tag we've shown a moment ago. This guy up here in the top left is the portal beam. This is the battery powered device, replaceable AA batteries, sticks on the ceiling, maps the room with infrared, but it also has air quality monitoring, has a whole load of environmental monitoring pieces in there. So temperature, humidity, light. You see this little circle up here is even a thermal camera. So this gets used in office areas where you need to know whether the desks are being utilized or not. So there's all sorts of different ways that we can use one of these devices. And then lastly, that transitional service. So that when you're migrating your network, what we're going to use here is this guy, a Portal Lite, and this is effectively does a whole host of different things, but it's actually a plug for a 13 amp socket. So we don't have to do.
You put that in the room, the Bluetooth connectivity, maybe the slightly more legacy kind of infrastructure that you've got.
Absolutely.
Got a good question coming in the chat. So Orkan is asking, are IB pumps and IT assets are connected to the Wi-Fi? Can we track them using these services without having to tag them with BLE?
Yeah, absolutely. So when we get into the software side of this, absolutely. So anything that's existing there, we can always pull that in. So we have a single dashboard, a single platform that can look at all connected devices.
Okay, great stuff. So this goes to the IT gateway, and I think it's important as well. It's a cloud-based application, isn't it? So it's not. Sort of talked earlier on about IT's involvement in some of these projects. Can we have a server? Can we have some deployment on devices? This is the cloud-based solution. So if you've got a large kind of ICS region or a large health board, for example, your application is in the cloud. It's going to be available really wherever you've got internet connectivity.
Yep, absolutely. And of course, a lot of applications already in the cloud that are actually being used on a day-to-day basis.
Okay, so let's have a demonstration, Stephen. You have to show us how it works.
Okay, so what I've pulled up here, let's start with it. This is our demo system. So we've got lots and lots of different use cases we can show you. So let me pick off one of these maps here. And what we've got here is a digital representation of an acute trust. And we've got different buildings, we could have different floors, etc., clinics. The digital mapping, of course, is a case of taking that from estates or even from DNA Spaces from Cisco might already have that map. So we can pull in information a different way. And then what we're doing is we're doing a digital representation of where all these rooms are, but that's an overlay in this system. So there's a lot of power in here to make sure that we can stay up to date, which is the key point I wanted to get across here. Even if there was a new wall and something joined together tomorrow, we can very, very quickly dive in here and change that. So we recognize that that's room 220 and it's joined in with 218 and made a waiting room. So it's fluid, and we go on a journey with this sort of technology. Now, what are we showing? You see lots of icons here. Well, so you can see I've got a list of all different things that are showing on this floor right now. But let's go ahead and use the search criteria. So this is just a web-based, a browser-based solution. There's no proprietary applications to install. So you can access this from any handheld device or, a nurse's station, computer, whatever it is. So I've just typed in IV pump because that's what I'm looking for right now. I can see there are 4 available here. Well, actually not available. There's 4 on the floor, 6, 7, 8, and 9. We can see 6 is currently in the dirty storage on floor 2, but it's been there for 8 hours. That's quite a long time, perhaps. Maybe that doesn't meet our cycle point, but we can look at that data in a minute. I've got 1 in room 219. I've got 1 in dirty storage in the cancer center. Here's a clean storage. Where is it? It's over here. So now I can go in and see it on the map. I can see it's an Alaris 7231. I can have an image of it as well. So as a reminder, because I don't know, make some models, I recognize it from the picture. I can see our battery level is fine on our tags. Now, the other thing is we can see it's available here, but most important is this next preventive maintenance date. Look, it's 29th of June. I think we've passed the 29th of June already. So perhaps this one's out of compliance. So this is where we start understanding if that was in clean storage and it was there on the 29th of June or before, surely that would have been a perfect time for the medical engineering team to get in there, take it out there, do the piece they need to do, or perhaps even better, when it's in dirty storage, they could come and do this guy. So, is this, let's have a look at the preventive maintenance day here. It's the same day. So 29th of June, it's sitting there unused and arguably unusable. Wouldn't that be a good time to make sure that we're running compliance with our assets?
I'm going to ask a question that I know my Wi-Fi engineers would be asking. How does that map get into there? How does that representation of the organisation go into the system? Is that something that can get loaded, or do you create that in the solution?
Yeah, so the team at Contact create this from the floor plans, or we can use it from what the Cisco DNA Spaces, if that's already there. So there's a number of different ways of doing that, but that's the first phase really of getting us up and running, is to understand where we want to start with any of these projects. And that's the important thing to get across to everybody today. It's not something you would typically say, let's go and do the entire trust, all sites, every possible service. All the hospitals we're working with today will usually start with one area and say, well, let's just start in this cancer center, for example, or perhaps in maternity where we've got dedicated assets and we can start there. And then we build. And the key thing here is, depending on that network infrastructure, it's incredibly easy to just keep building over time as and when budgets allow for it. It's the same system, we're just adding more devices in there.
How scalable is it? Health board or an acute trust, there could be many thousands of devices they need to keep track of at all times. How can we get to that place where if you're the head of medical engineering, all of the assets you're responsible for are held in the solution and trackable by the solution?
Yeah, well, ultimately, this is really down to the strength of the Bluetooth low energy network. So if we have a Wi-Fi network with Bluetooth capability, then we're away. But remember, we also have the migration service. So it allows us to put it over Wi-Fi. So if there's any sort of Wi-Fi, We can also plug in the gaps using the migration service. So once we've got some way of these sensors talking back via, over an IP network, we're away. So that's a case of scaling. And because Bluetooth Low Energy is using tiny little data points here, it's really very easy for us to scale this up to tens of thousands of devices talking across, because it's not a huge data. We're not video streaming.
Okay, great.
So what I'm showing on here, I just wanted to share really, is around PAR level. So this is a classic example of saying, look, in the cancer clean storage, we should always have at least 2 and perhaps a maximum of 4, but you can see we're down to 1. In fact, you can see we're under in all of these areas, but it would be very easy for me from a medical devices or even a finance team to come in and say, well, look, do we actually need to buy more? Should we be buying more equipment? And we can get that information really quickly here. So we can see we've got below, but just as easy, we can see there's nothing above. So we've definitely not got spare in there across, across the trust. So lots of information. We talked about PM date. I can get a list of pumps. I could quickly dive in there and just as easily see what's going on. We've got environmental monitoring. There's a whole host of reports, which I'll go in here and just show you the sort of things that we can get once we've tagged everything, if you like, and we decide how much we're going to do. All of a sudden, we can get into this kind of area where we can see utilization of ventilators on floor 1 versus floor 2. Now, how easy would it have been for you, previously to get this sort of data? I'm assuming it's a manual thing of someone with just not a clipboard or
really, I would say, less than I had audited on that day in terms of where things are at that point in time. It's it's just not possible. So we've got this basically on a dashboard now live to be used when needed.
And it's not using human resources to go and get this data. People walking around with clipboards. I've heard of teams that have started with manual clipboards, then go to an Excel spreadsheet, then going to an app which they're paying licensing for. Well, actually, it's all part of the same system. And you can see here, from a buildings and estates perspective, how these particular exam rooms are unoccupied. How much time are we actually using in these consulting rooms?
Yeah.
Now, I'm assuming this isn't representative of the NHS. I'm sure it's much higher than that. But of course, we're getting real data now. So from a new hospitals program, we now know whether we actually need to do this or not, or are we just using the space?
Yeah, that's really interesting. Quite a few sort of hospital build projects and location building projects, just thinking about how maybe some of this could, maybe a bit optimistic, but some of this could help to just think about how space is used inside the hospital as well.
Yeah. So what else can we see? We can see, any items or people in a particular space between a certain time. So there's an asset report of, how many have ever passed through here. Cycle time is a really interesting one for us to look at. And this is obviously a big one for the care providers. So it's just now doing a calculation across here. And we can now see how much time is being spent between different areas. So if we're looking within urology, we've had 47 visits. The average cycle time is 89 minutes. And we can see discharge there in exam in radiology. So waiting is the biggest chunk, 25 minutes on average that people are waiting. So this is the sort of data when we get into the management team, the leadership team, of course, within the trust, could get this just from, the sake of potentially a couple of pounds a month, as part of a whole tracking service that's provided.
Yeah, I think it's really useful if you think about people waiting in ambulances, for example. If you could maybe just look at flow through emergency department perhaps and just think about not tracking individuals or where they are, what they're doing for the sake of it, but actually trying to get a better system in place and using that data at that management sort of decision making level to look at where improvements need to be made and what we can do to really improve the kind of the throughput, if you will, of that area. I think that's really, really powerful, Steve. So I'm just curious, I suppose, really in terms of one of the questions I've asked recently. I know you don't necessarily have the answer to this today, but if you had a recall on a product, presumably you've got your list of assets in the database, you can just go and highlight I'm going to arbitrarily say all of the trolleys, of a particular model. We can get a list of those. We can get a list of where they are. Someone can go off and go and find those. And again, you're not wandering around the entire organisation trying to find these things. You've got pinpoint accuracy of their location. Presumably, if they're wandering around the organisation, you've got your handheld to just keep track of them, and you can go and bring them all back, and do the maintenance you need to do on them.
It's a good point that you make. Need to think about when we get down to the specifics is I want a particular device. So we have the whole kind of GS1 compliance piece, of course, in the trust around QR codes, and everything has to have a specific ID. Well, we pair all that up with these guys. So, that will show that this particular tag, which has a QR code on the back, is tied to that particular IV pump number 12345. So we can quite quickly run a custom report on that and say, show me where 12345 or every one of that type is right now, and then hand that out to the people who can run around the hospital and go straight there. But we are talking about massive savings in time on a day-to-day basis, especially around the preventative maintenance piece.
So I think that's really important. It's making to find this equipment that we're really kind of saying you've got that, you know where it is straight away. You still got to go and get it, but you know where it is.
You've got to go get it. And in fact, it came up with a trust earlier last week where the nursing team were just saying, just think about what we have. We have beds, a little bedside cabinet and a jug of water on there and a patient. There is no medical equipment there by default. So we have to go and collect everything, and every minute lost looking for something that isn't in the storage area where it was supposed to be, because when everybody goes, there's none there, so therefore they take one and then hoard it and keep it in their own little area. All of that sort of behavioural thing, which is at the end of the day is positive intent for the right reasons, about delivering the best service of care, but actually at a bigger level is we end up with a mismatch of where the actual medical equipment is, where the patients are, where the staff are.
Brilliant. So just thinking about time.
Yeah.
Deck. We've done the demo. Just tell us about Contact Eye, a bit of a recap, really. What's different about Contact Eye then?
Yeah, so the key thing here, real-time tracking. So in terms of pinging, it's every minute, so we know exactly where everything is. It's not every hour.
Yeah.
So it's super flexible. The room level accuracy is really what unlocks all of this reporting and this ability to set rules. So when something goes into dirty storage, the status automatically changes. Not when it's within 20 meters of dirty storage, you just couldn't do that. So that's the big change from this RTLS versus RFID, some of those other technologies. The lower total cost, the cost of these tags, typically, £2 a month as a full contracted out service, including all of the software and the warranty and everything else that comes with that. So it's super flexible. Also, I should just mention they're delivered as a contracted out service. So now we have the VAT exemption, the ability to recover that from a zero rating perspective is huge. So there's 20% saving of any other technology where you would typically go out and buy it and own it. There's no point. Why not buy it as a service? Don't worry about these. Contact and we'll make sure that the tags are always up and running for the length of that service that you need it for. The ROI is so much quicker because we can spin up a demo literally in an hour, on site and get it working in a real world environment. No longer is it we need to plan miles ahead and arrange for cabling and all those other things that need to happen. Even in a proof of concept, we can even do this over a 4G network if we need to do it, because there's no one from IT available. So we've got lots of options to be able to move quickly on that. Low energy, great, and the Cisco optimization is really from the partnership between Contacts and Cisco, which is pretty special.
Okay, fantastic. Thanks, Stephen. So, where would we start in a hospital if we were going to try this? What in your experience would be the first place that to get going and contact there?
Yeah, well, whilst we've talked around, staff and smart badges and patients and those other things, really the first place and the one where you see the quickest return for sure is around medical engineering, clinical engineering teams. So those MEMO teams, and various different acronyms for them, without a doubt. So this is really picking off perhaps a particular area within a hospital where you've got high value devices, regularly shared, high volume turnover, you need to know I've got the right amount. Now, perhaps that's an area that uses a lot of rental equipment. Perhaps that, you know, a customer said to me around bariatric pieces where you rent a bed, you rent a mattress, and you rent a pump. There's 3 pieces, but unless all 3 pieces go back, then you continue paying that rental charge. So why not tag all 3 pieces? Maternity, there's Doppler scanners. They only stay really in maternity, so that's a great place to test as well. So it's really down to the trust, and that's why we've got the designed for you element here, because everyone is going to be slightly different. Everyone has different emergencies in terms of knowing where things are. But we all suggest start small. You know, let's not start too big. Don't be too brave and start with 10,000. We always think, you know, 50 to 100 is a great starting point.
How quickly can you get a system up?
Next week. Just allow time for us to get to site and to work with the teams, really. So it is very, very quick, depending on obviously that network, whether we need that extra buffer service or not. If you're already a Cisco Wi-Fi 6 network, it's a case of we just pre-configure these devices for DNA spaces and away we go. So it can move very, very quickly, and we can start seeing what potential there is for the next budget cycles and so forth, be able to get that in there.
Really what the tag itself is attributed to, isn't it? But how quick and easy is it to kind of upload all that data that you've got at the minute? You might have a spreadsheet of assets. You just take that into
you can do it by if the asset database, then you've already got one. That's the first thing. Is there one?
Yeah.
And is it accurate? It may not be the case, but we can take whatever data is available today, and we can always supplement it manually if we need to with mobile app and go around and literally look at barcodes and enter numbers. But we, as much of that can be pre-staged before we arrive on site.
How quickly realise the value of the solution?
Well, for the clinical engineers who are losing half of their day looking for things tomorrow, it really is that quick. With patient cycle time and changing workflows, of course, there's a lot of other processes that we need to have a look at, or the hospital would need to look at as part of that. So perhaps that's not quite as quick to make changes, but you'd certainly gather the data immediately.
So yeah, it's like any project really, finding your benefits and measuring and tracking them once you've put the solution in. But I agree. I think it's pretty much day one once something's up and running. If you need to find a bit of equipment, you can find it straight away rather than have to really kind of audit the organisation and try and figure out where it's gone. And
let's not leave things in dirty storage for 3 days, but no one knew, or we've got 25 ventilators on one floor but 0 on the other. All those sort of things you can change very, very quickly.
Stephen, we're nearly at the end of the webinar. I need a couple more bits to go through. So just, thank you very much for hosting us at the Ingram Micro offices today. It's been challenging and interesting, but enjoyable. Genuinely, if you're interested in this, I think it's a really useful solution for healthcare, finding information, devices out where they are. Please get in touch with your account manager at Block, and happy to have anyone drop us a line if they need to. And yeah, we're more than happy to talk more about this. Just head over to the sort of Q&A. I don't know if there are any more questions unless we get one during the webinar. I haven't seen any more come through yet. So if you've got any, please send them across. And while we wait for that, I might just explain that you've got webinars in this series. So yeah, so as I mentioned at the start, this is the first webinar in a series. The next one is going to be securing the healthcare network, which I'm quite interested and excited by. We're already working on the content for that one. A bit later in the summer, we've got designing the always-on healthcare network, and then towards the end of the summer, building a cloud-ready network architecture. So it'd be great, again, to sort of see people join up and participate in the debate on these things. I think it's something I'm really passionate about, is IT and healthcare and getting the best out of the technology. So we'll just head back to sit in your question. So how do you think it's a question that's come through in the chat?
Right. Yeah, so first things first really is decide where. Yep. And what that expectation is, so in terms of a demo, as I said, we could take it completely off network. We did one last week where we just popped on site, even if it's offices, but ideally you'd want to get the people, the stakeholders, the right stakeholders involved. And I think that's probably the critical takeaway for today, is that if it's led by IT, which is great, but only ever seen by IoT, we're not really going to see the real benefit of that trial. So the pilot, we would really want to be talking perhaps to the medical engineering team, and have them tell us where do they want to start. And then it's a case of just making sure we're available to get to site, set perhaps some portal beams up, give us some room level. We could put up some asset tags on the key assets, and that's really all we need. So, and remember, everything's battery powered here, so it's a case of turning it on. We can do a lot of pre-staging before we even get there anyway. Of course, we need a map if we want to see that. So we'd probably need a day or two just to put all those pieces together, and then very quickly get on site. And there's nothing better than the people actually going to be using this potentially for, you know, for a few days, 30 days, whatever it looks like, is to get hands-on with it.
Sure. Okay, thanks, Stephen. Another question come through. So I think we touched on this earlier on. So can Contact Eye support a mixed estate of, you know, Wi-Fi 6 and older Wi-Fi devices? So that's the plug socket, isn't it?
That is absolutely, yeah. So that's what Portal Lite is here for. So it's another service which you can subscribe to. Do you need it for a year or 2 years or 3 years before you get to that Wi-Fi 6 full deployment? But yes, we can always plug the gaps where connectivity isn't as good as it should be from a BLE perspective. But yeah, there's no limitations.
Another question that's come through: How does Contact Eye relate to Stanley commercially? You can answer that one. And
yeah, it's
can it interact with the not something I've heard of, but the CMX cluster? Is that something you're aware of?
Okay. So CMX is the pre-DNA spacing location part of Cisco. So there's two questions there, isn't there? So one, let's go back to the first one. So Stanley is a competitor to the Contact solution, obviously is dominant in this space and extremely strong in terms of solutions they have. The only slight downside and the challenge there is the integration with Cisco is not as tight as it is with Contact because of the partnership that's there. So we don't have the same challenges that they can have every time there's a wireless LAN controller software update, for example. Also, but there's proprietary hardware. As soon as you get into any sort of gateway situation that isn't just using your Cisco network, small cables, there's more IT devices to manage, more IT time to implement and manage on an ongoing basis. So great solutions, really broad, way broader portfolio actually in terms of what they have. However, the implementing of it is challenging, can be challenging. That's what we hear. And the ability to scale can get very costly. On the CMX piece, this is we're into older space, so we don't need CMX. Arguably, all we need to do is get Wi-Fi traffic on those older networks. As long as we can, you know, these act as Wi-Fi clients, and they just talk to the Wi-Fi network, and then we need to get it out the back. So that's sometimes where a wireless LAN controller is the critical piece. So we need to just understand what controller situation you've got today, and can we get that information back out to Contact and their cloud. Yeah, it's going to have a quick, a key but short technical conversation.
And, would it be possible for you to come in and set up a couple of hours and have a session with key stakeholders? I think absolutely. I would say the first thing to do is to reach out to your account manager, and then obviously at Block we can set that up for you. Okay.
Yeah. Perfect.
So I don't think there are any more questions. So just remains to say thanks very much for everyone joining today.